Hey everyone, we are Team Epic Heroes, and this is our group. We are preparing our first vision with respect to digital front door, blockchain, and UN sustainability goal. Now let us see a small video on NCDs.
Cardiovascular diseases, diabetes, cancer, and chronic respiratory diseases are known as non-communicable diseases. In recent years, these diseases have increased as a result of population aging, urbanization, globalization, and changes in lifestyles, and they've become the great epidemic of our age.
Now let us look at the steps to reduce this NCD impact.
Governments should ensure access to health services for its population, including access to early detection of disease, diagnosis, medicines, and treatment provided without discrimination and without undue financial hardship. People should be provided with information and support that empowers them to manage their own health, giving them greater control over their health and contributing to the health of their families. This way, all together, we can stop this terrible epidemic from getting worse and enjoy longer, more productive lives.
Our approach consists of 3 different steps. Our first step is to build an application end-to-end for digital front door and to integrate it with the data plugin of blockchain and then scale it up to the clients. With growing number of clinical devices, smart wearables, sensors and monitors, there is a visible need to connect the data streams from the user's devices to the caregiver's dashboard, be it alerts, notifications, reports or escalations. We are bringing together all these devices and communication channels into actionable, intelligent and decision support ecosystem. This sums up the birth of our idea, Quantum, where we intend to build a platform for connection as a service supported by IPFS, where the user's data is being carried over by different IPFS nodes. And though we have 3 different methods of retrieving the data, we pick up the API method. Now let us see a demo of how this API method of retrieving data works. This is Mithri, a humanoid robot, and we have developed an inbuilt application where the user can register their essential vitals by just interacting with this robot using NLP and facial recognition technology. Mithri can also support telemedicine, which means it can be used by the providers in order to collect data streams from different patients across different organizations at the same time. It is also compatible for remote monitoring and remote hovering across the environments. Now let us see an example of how Mithri can connect to patient and the provider inside an organization. Patients can interact with these devices and register their vitals. Our current method of disease diagnosis doesn't take into consideration of the day-to-day behavioral data, which is the USP of our solution. All of these data are recorded in blockchain using IPFS using 2 new standards, TAG-JOS and EIP 2844, for signing and encryption. Our mission is to predict and prevent instead of treatment and diagnosis.